terms of trying to get a natural result, it's not just about the numbers of grafts that are transplanted, but it's also about the angle that the grafts are grow at. So we want to marry up the graft growth angle with the patient's existing angle of hair growth. So we do test incisions, and that allows us to get an angle that will be appropriate for that graft to marry up with the surrounding hair. Once that graft starts to grow, that angle might change, so we've got to bear that in mind as well, because if we get any microscopic scar within the graft, then that might change the angle. So we want to get it all to marry up. We plate out the grafts. Whenever the grafts will come out, those that come out in the first hour will go into this plate, and those in the second hour will come into this plate. And that allows us to identify those grafts which have come out earliest, and thus they'll go back into the patient earliest as well, to minimize that out of body time. You notice we've also categorized the grafts depending on the amount of hairs within each graft. So 1 hair graft, 2 hair graft, 3, 4, etc. Because we'll then use the appropriate hair for the appropriate location to where we want to transplant that hair. So it's about getting graft survival, but also the right hair in the right place at the right time.